Back to school season is a busy time for eye care practices around the country. This year, we spoke to 5 optometrists specializing in pediatrics about their advice for managing the influx of patients while still providing high quality and individualized care. Here are the highlights from those conversations. We'll start with Dr. Maria Sampoulos, who leverages the back-to-school season as a key opportunity to promote pediatric myopia management.
No, back to school is a great opportunity. I mean, even if you don't have a lot of kids, I mean, it's just educating, grandparents that you see, the elderly population, because they have grandkids. They have people they talk to, right? Word of mouth is very big. So just doing what you're supposed to do, just being a good doctor, kind of focusing on taking care of the patient, a lot of things will really follow. We have to make sure that they fit right, they look good, that they understand what they're getting. Some kids are excited about it. It's not like it used to be with glasses. And some, find it as something that they don't want to do. They don't want to wear. They might be made fun of at school. So that positive approach, sometimes I'll come into the optical and give my opinion and how they look and make sure that they're good quality and sturdy, because if it is a first time purchase for that family, we want to make sure that we give them good quality so they're not coming back and discouraged with that. A lot of times they have misconceptions on things. Sometimes things are cheaper for a reason, is what I tell them. We want to give them good quality, look good, and then also explain the lens options with the blue blockers, with the myopia management lenses, things like that as well, so they understand. And polarized glasses or transition lenses to protect their eyes from the sun.
Dr. Leslie Scher explains the key difference between a standard vision screening and a comprehensive eye exam performed by an optometrist.
I think the most important thing is that kids don't know if what they're seeing is clear or not. They think that what they're seeing is normal, and what they're seeing is how they should be seeing. Vision screenings are great. Pediatricians' visits are great, but they don't always check one eye at a time. They're not checking binocularity, which is such an important aspect of vision, how your eyes are working together. So because of that, we do need comprehensive eye exams, even if you feel like your child is seeing well, even if you feel like there's nothing wrong, you've never had any issues with your eyes, your spouse doesn't have any issues with their eyes. We're seeing a lot more problems these days, and if we don't catch things early, especially binocular vision issues, that can impact school and learning, and your ability to read, be able to see the board at school. So really coming in for those routine eye exams, even if you don't think anything is wrong, is so important. And I usually tell parents, we can see them as young as 6 months old, but really try to get them in at least before age 8, because that is usually when we start to see those vision problems.
Next, we'll hear from Dr. Pamela Theriot, who advises parents on the best ways to encourage healthy screen habits at home.
Well, absolutely. It's a busy time in most optometry practices where we're encouraging parents to bring the kiddos in, have that eye exam before school starts. I think that's probably typical in all eye practices across the U.S. So getting the kids back in right now is super important. Getting those prescriptions updated, a second pair of glasses, the sports pair, having those conversations about what are we going to do when we're playing football, basketball, softball, gymnastics. And a lot of times we're even getting kids into their first pair of contact lenses as well. So I have a handout that I give parents, and it starts off by setting the kiddo up for success. So we want to look at how close are their screens. And maybe that's not something that we can control while they're at school. We can tell the students to, keep the monitor at arm's distance, so that, maybe they touch it with their fingertips, but not the palm of their hand. We can encourage them by setting things up at home in the proper manner. Having the monitor in a downward gaze is another key, so that we're looking 20 degrees down. And then inciting that 20-20-20 rule. So we're encouraging students to take a 20-second break every 20 minutes and typically we've told patients to look 20 feet away during that break time. That little break in the up close focus was thought to help control myopia. Now, it turns out there's not a whole lot of research around that. That 20 seconds is going to do a lot to help myopia, but I do think taking that break and having a couple of really significant blinks at the same time can help to re-stimulate the meibomian glands, get them working again while they're sitting in their chairs. They're not having to get up and move around the room to do this exercise of their eyelids and get the meibum to start flowing again.
Dr. Katie Chu empowers her pediatric patients to take ownership of their eye health.
So it is my opportunity when it comes to back to school that they have to understand that vision is not just used to play video games. Vision is a way for them to learn. And so I really emphasize that to the child. Of course, the parent, usually the mother, is sitting behind me. And so she's listening. And I think it's very empowering when the parent sees that I am talking to the child with respect and as if they were comprehending everything. And of course, then later on, I will bring the mother back in to the conversation, but that's usually at the end of the exam. So after the exam, I bring the child back to sit next to the mother and I'll do a summary of everything. And so back to school for my staff, it's actually a very busy season. Thousands of kids will come through. August, September, October. Usually the holidays, the children don't come in as much. During the holidays, it's going to be usually the parents coming in. It is a great opportunity for us to educate them and tie it back into learning through their eyes.
Finally, we'll hear from Dr. Mile Brujic, whose short series covered how practices can prepare in advance to ensure a successful back-to-school season.
As practice owners, I think we need to do a few things right before school is going back in. One, we need to be well prepared for a younger demographic. Two, we need to make sure that those individuals that are heading off to college are well prepared with the supplies that they'll need to get them through the whole year. So if your supplies aren't something that you advocate, make sure that you're doing that so that they're well prepared and they have everything that they need. And the third and most important thing, make sure you're asking about contact lenses, because oftentimes these patients are coming in during the summer in order to get those lenses. Oftentimes the new school year is the opportunity to have that new look, that new experience, and that's oftentimes what students are looking for. Keep those three things in mind when it becomes back to school time in your practice.